Hi everybody, Dr. Britt Talley Daniel MD, neurologist and headache doctor. And today I'm YouTubing about a subject called medication overuse headache may be confused with cluster headache. I've heard it time and again in my office, people tell me they have cluster headache when they really don't. So cluster headache is a trigeminal autonomic cephalgia, which is an entity completely separate from migraine, although they may have many similar features. Medication overuse headache is 80 to 90% of new patients in a headache doctor's office. So medication overuse headache can be confused with cluster headache. Cluster headache is named because the headaches cluster in time. As they group together in time, they may come 1 to 8 times a day for 6 weeks and then they stop. That's the cluster. Patients then headache-free in between the attacks. Episodic cluster lasts 6 weeks, while there are 10% of patients with cluster headache who have chronic cluster, and it occurs continuously. Migraine patients who overtreat with migraine may have continuous all day long, every day, mild to moderate headaches with pain spikes up to several times a day or a week, and this may last weeks, months, or years. So the difference in attacks. Cluster headaches are very quick, severe onset pains. Onset to peak is like 15 to 20 minutes. They're one-sided headache pains, which consist of pain around one eye or the temple or the cheek. They last 20 to 40 minutes. They usually only come on one side of the head. They can switch over, but mostly they're one-sided. That's how it's taught. Migraine headaches may come over half an hour or two, but may last 4 to 72 hours, and commonly will switch sides between attacks. Although many patients say, migraine patients, my headaches always turn on the right side, but every now and then they'll turn on the left. That's more like migraine. Cluster headaches has characteristic symptoms such as drooping one eye, smallness of one pupil on the involved side, sweating above the eye and the forehead, redness of the eye, tearing of one eye, nasal congestion, and drainage of clear fluid all on like the right side. Migraine doesn't have these features usually. Cluster patients can't hold still, and they get up and pace around the room, whereas migraine patients are disabled. They usually lie down and want to be in a cool, dark room and not move. They don't like to be up and about. Nausea, vomiting, and sensitive to light and sound may occur with cluster headache, but they're not prominent as in plain old migraine, or migraine that's been turned into medication overuse headache. Cluster headache persons have family members with migraine, just like migraine patients commonly have a history of migraine in their family. Cluster headaches usually doesn't come in the family, but there's some new data saying it may occasionally come on that. I'll have an article on that later. Cluster headache predominates in men, usually 4 times as often than in women. The time to onset. This is important, the differential between cluster headache and migraine type headaches. It's very quick with cluster headache, often in minutes. The headaches also may track the clock, coming at the same time every day. They may characteristically occur 1 to 2 hours after going to sleep. So the patient goes to bed at 12, 2 in the morning, they're awakened by this terrible headache. What are the aggravating features? During the cluster period, drinking alcohol, taking nitroglycerin, or histamine may aggravate the headache, but not at other times. And also, the patients usually have a driven type A workaholic nature. They kind of link into OCD or obsessive compulsive disorder people. Clinical differences. As noted by the description of migraine and cluster headache, they're really very different neurologic problems. Migraine and medication overuse headache are very common in the clinic, while cluster headache is relatively rare. Since cluster headaches may occur daily or multiple times a day for several months, they're confused with medication overuse headache, which also may come daily, but sometimes every day for 6 months or several years, which only comes with chronic cluster. The onset to peak time is in minutes, and that's different from migraine, which may take a couple of hours. Also, a cluster headache patient has true headache-free times between the attacks, which is rare with medication overuse headache, when they usually have a background tension like headache in the neck or some kind of head pain that's grade level 1 to 4 or something like that. And then they have a severe peak of headache later. Also, cluster headaches are typically locked into one side of the head and usually don't switch sides, while migraine is related to medication overuse headache may switch sides and commonly comes in the back of the neck or head or on one side. Many patients are thought to have cervical disc disease or osteoarthritis in the neck, or something wrong with the neck or occipital neuralgia, and it's really just medication overuse headache with a predominance of pain located in the back of the neck. Lastly, in fact, the cluster headache may occur locked into certain times, like every night at 12 o'clock or around 10 p.m. should make the penny drop with a diagnosis of migraine headache. Medication overuse. There's an epidemic of clinical cases of migraine in persons who overtreat. It's rare for cluster headaches to overtreat, but there is some articles about that. I don't think I've ever seen it personally, but it does occur. It's in the literature. A careful medication history should be taken of all drugs, including the amount of caffeine taken and supplements. The treatment response. The treatment response is different for cluster headache and medication overuse headache. Injectable subcutaneous sumatriptan, intramuscular DHE, nasal spray sumatriptan, rizatriptan, or other of the triptan drugs, and there are 7 of them. Migraine acutely will help that usually, and it may also help cluster headache. But that doesn't really help. Medication overuse headache will knock the headache down a little bit, but doesn't get rid of it. DHE's injection and migraine nasal spray are commonly used to treat medication overuse headache because they work of some degree, but they don't accelerate the process of chemicals in the brain that keep giving you a headache, like triptans can do that. Medication limits. Migraine patients should limit all painkillers and caffeine to no more than 2 days a week. And caffeine is the #1 drug in the United States that aggravates medication overuse headache, while in Germany the #1 drug is Tylenol, also called acetaminophen. The International Cluster Headache Society lists amounts of drugs which may cause medication overuse headache, and their lists are triptans, ergotamine, 10 days a month, like sumatriptan. Non-opiate simple analgesics, it's 15 days a month, and that's aspirin, Tylenol, caffeine, or Advil. Opiates or analgesics really should never be used with like barbiturates. Those drugs should never be used, and 10 days a month can give you a headache. Patients who develop medication overuse headache frequently have either frank acknowledged migraine or rarely tension type headache, or called previously undiagnosed migraine with migraine features, and they call it sinus headache, menstrual headache, one-sided headache, they're throbbing headaches, which is a migraine feature. They have a severe headache on a scale of 5 to 10. They usually have, like, they'll tell me at a level 10 headache. They have hungry headaches, motion sickness, headaches with nausea and vomiting, headaches with sensitivity to light and sound. These patients with these features present to the doctor with chronic migraine. Go to my webpage, drmigraine.com, for more articles. I have a whole group in a folder on medication overuse headache and also on cluster headache. So that ends my talks and thoughts on how medication overuse headache can be confused with cluster headaches. Not an unusual thing in the clinic. All you patients, please don't go there and limit medications you take. Thank you for listening to this. Please subscribe down there so we can follow each other. Look for me on YouTube for other talks on migraine. And God bless all you persons who've had migraine, medication overuse headache, or cluster headache.